Okay, let's unpack this. We are diving into one of the trickiest, most high-stakes sectors out there, MedTech. And here's the statistic that really sets the stage for our deep dive today. A staggering 75% of MedTech startups ultimately fail.
It's a brutal failure rate, yeah. And what's really fascinating here, and all the sources we looked at confirm this, is that the reason isn't usually technical. It's not that the solution isn't clever or scientifically sound.
Right, so if the technology works, what is the single biggest reason it fails? We keep hearing about this MedTech paradox where, success dies not by code, but by market failure.
It's market failure,
Ah,
driven by a deep structural complexity. The failure really stems from these poorly understood forces, things like clinical adoption, reimbursement, how it fits in the ecosystem.
mm.
These are the forces that can sink a brilliant idea before it ever helps a single patient. I mean, building a great device, that's maybe 20% of the battle.
And the other 80% is navigating the maze of the healthcare system.
Exactly.
It sounds less like an innovation opportunity and more like a minefield. So our mission today is to look at a strategic navigation system built specifically to cross that minefield. We're unpacking the EMC StarMap from EvoMed Consulting and looking at how it turns that complexity into what they call actionable clarity, especially for ventures backed by accelerators and VCs.
And that's the key audience here. For VCs and accelerators, this isn't just another tool for founders. It's a structured way for them to de-risk their own portfolios. It turns those hidden risks into a predictable roadmap that they can actually rely on.
Okay, so let's start right there. The biggest risk isn't technical failure, it's market failure. If the tech is great, why did the market just reject it?
Well, it means you might have built an amazing life-changing device, but if it doesn't fit into how a doctor actually works during the day, or if no one's willing to pay for it, or, and this is a big one, if it adds paperwork,
Oh, forget it.
it becomes shelfware instantly. And the StarMap framework was built to fix that exact gap. It uses years of clinical leadership experience to give founders a kind of radar screen for those hidden risks.
I do like the visual they use. They call the key factors constellation points. It suggests this whole universe of things that have to be in alignment. Tell us about that.
Yeah, the framework visualizes the whole landscape as an interconnected set of 7 critical factors, the constellation points. And interconnected is the key word because they don't exist in a vacuum. They're constantly interacting, reinforcing, or sometimes sabotaging each other. So, for example, a weakness in your technical integration is going to directly sabotage your economic viability down the line.
So it's not enough to just nail one or two things like the cool tech or the clinical benefit. The whole constellation has to align. Otherwise, the friction between the points just drags the whole thing down.
Precisely. And in their visual, the size of each star actually reflects how much it contributes to scalability. So the goal for the founder and for the investor listening to the pitch is to use this to build a strategy with, as they say, surgical precision.
Okay, let's dig into the 7 pillars. First one up. Specialization and clinical depth. This seems kind of obvious, but what's the specific trap here?
The trap is being too broad. It's the everything to everyone syndrome. Specialization means you focus your solution on a very clearly defined medical problem, a specific patient group, a procedure. You deliver exceptional targeted value.
And if you're everything to everyone, you end up being no one's first choice.
You're exactly right. The key insight is that specialization builds trust and credibility incredibly fast. Think about it. A cardiologist is way more likely to adopt a tool built specifically for cardiac patients than some generic device with vague claims.
Okay, moving to point 2. Predictability of services, which they also call workflow integration. This sounds like where the rubber meets the road inside a busy clinic.
It absolutely is. This is where great ideas often go to die. Predictability is all about how well your solution fits into and, ideally, improves the existing workflow. It has to reduce variability.
So ease of use is actually more important than some flashy new feature that makes everyone change their routine.
Much more important. The sources are really clear on this. Clinicians want tools that fit naturally into their day. If your product forces staff to radically change their habits, or the ultimate sin to double document information,
That's an immediate no, a huge red flag.
it's a huge red flag. The goal should be to eliminate steps. Maybe automate documentation that used to take 3 clicks down to 1. That's real value.
That's a great test for any VC to ask, is this add clicks or remove them. All right, on to number 3, ambulantization and digital care models. This feels like it's about future-proofing the business.
It is the core strategic move in modern healthcare. Ambulantization is just the trend of moving care out of big, expensive hospitals and into outpatient clinics, specialty centers, and, the patient's home. And our sources say over 75% of medtech leaders see this shift not as an option, but as an imperative.
So if you ignore it, your product could be obsolete in 5 years.
Totally. Your solution has to be portable, flexible, cloud-based, and really user-friendly. And here's why. Those outpatient settings and patient homes, they don't have a big IT department on standby.
Right. It needs to be plug and play.
It has to be. That simplicity is what opens up new, lower-cost ways for your customers to make money, which makes you a much easier purchase.
Okay, point 4, cooperation and ecosystem fit. Interoperability. I hear terms like HL7, FHIR, ICOM. For those of us who aren't healthcare IT experts, what does this actually mean for a founder?
It means your product doesn't live on an island. It just can't. Interoperability is non-negotiable now. It's the cost of entry. FHIR and HL7 are basically the languages that let your device talk to the main electronic health records. DICOM is the standard for medical images.
So if your product can't speak that language, it's essentially invisible. It's irrelevant.
Completely. And the data backs this up. 86% of medtech execs say future success depends on targeting the whole care pathway, not just selling a standalone box. If every new client needs a custom, expensive integration project, you'll never be able to scale. That's a huge turnoff for investors.
Which brings us right to the money. Point 5, economic viability. Why is this so difficult in a field where the demand for life-saving tech should be, endless?
Because in healthcare, doing good isn't good enough. The financial case has to be rock solid. Economic viability means you can prove a positive return on investment and ROI for the hospital buying your product.
So the clinical benefit alone, the "it saves lives" pitch, is not enough proof.
It's insufficient. Consistently, the top barrier to adopting new digital health tools is a lack of clear reimbursement. You have to quantify the value with hard data that speaks to the CFO. You can't just say it's good for patients. You have to say, our platform reduced hospital readmissions by 15%, which saved this hospital $400,000 last year. That's the language they understand. VCs need to see that.
That makes sense. That moves us to the last 2 points, and these feel like the difference between a good product and a truly indispensable one. Point 6, quality of care and patient safety.
Right. This is about proving your impact. It's about showing real-world improvements in patient outcomes. Faster recovery, fewer complications, better patient satisfaction. That kind of outcome data is king, especially as we shift to value-based care.
Which means founders need to be thinking about collecting that data from day one, from the very first pilot program, right?
Oh, absolutely. Collecting that evidence and then ideally publishing it in peer-reviewed studies is incredibly powerful validation. It's the coin of the realm for getting clinicians on board. And it also means focusing on human-centered design to minimize errors. That builds long-term trust.
And finally, point 7, the one that kills so many good ideas, implementation friction. It's so easy to overlook just how hard it is to get something installed and used.
It is the #1 reason, according to the source material, that even brilliant medtech products fail. It's the practical reality of deployment. Your project can die a slow death from 1,000 bureaucratic cuts, IT roadblocks, legal reviews, user resistance.
So a product that is technologically superior but takes 6 months to deploy is actually strategically weaker than a pretty good product that you can get up and running in 6 weeks.
100%. That implementation timeline is a massive de-risker for any investor. Smart startups invest heavily in reducing that onboarding time, from months down to days or weeks. They also have a playbook ready for the common objections, like, this is more work for me, or this might break our IT systems. If you can't sell your solution to the doctor, the IT guy, and the CFO, it's dead in the water.
That makes perfect sense. Now let's pivot and speak directly to the investor, the accelerator manager who's listening. How does using the StarMap specifically help them protect their capital and, scale their winners?
This is where the framework becomes so valuable for them. It's explicitly designed for VCs and accelerators to use for investor reporting and due diligence. Remember, most failures come from these adoption gaps, not bad tech. So the StarMap lets an investor flip the lens. It reveals those hidden systemic risks in a structured way long before they cause a company to fail.
It's basically a diagnostic tool for their whole portfolio's health. It lets them spot the ventures that are truly ready to scale.
Exactly. For a company in an accelerator program, it focuses them on these 7 critical factors. For a company raising a Series A or B, presenting a StarMap assessment provides what they call board-level clarity.
It gives them a credible roadmap instead of just a hopeful pitch.
Yes, and it replaces months of painful trial and error. It shows investors you've thought through the hard questions.
So when a founder walks into a pitch meeting with this kind of systematic assessment, how does that change the conversation?
It changes everything. An investor immediately sees they're dealing with a scale-ready MedTech founder, someone who gets the full clinical, operational, and financial picture. If the StarMap shows a low score in, say, economic viability, that founder can proactively say, this is our weak point, and part of this funding round is to hire a reimbursement consultant to fix it.
Which shows incredible self-awareness and strategic thinking. It builds trust.
It totally shifts the conversation from just cool tech to holistic readiness and risk mitigation. It helps everyone see how a weakness in one area, like cooperation, silently drags down other areas, like predictability. It provides true investor-grade clarity on where to put capital for the biggest impact.
So instead of guessing where the blind spots are, the STAR map gives you a radar chart that shows exactly where the friction is, allowing VCs to protect their capital by betting on companies that have aligned all 7 of these success factors.
It ensures the venture is built not just for clinical trust, but for commercial viability from day one.
Okay, let's bring this all together. It's clear that MedTech success requires so much more than just innovation. It demands this deep strategic alignment across clinical, financial, and operational realities. And the STAR map provides that structured path.
And ultimately, the goal is always impact. The sources are clear. The ultimate measure of success is a sustainable business that translates to real, long-term, positive patient impact.
Well, we just spent this whole deep dive on the complexity of MedTech. Since the material says over and over that implementation friction is a primary reason for failure, I want to leave you with this question. If you are an investor, how would you quantify the strategic value of reducing a product's deployment timeline from 6 months down to 6 weeks? Is that operational speed, that reduction of friction, worth more to you strategically and financially than a single groundbreaking new technical feature? Something to think about.